Hello, my name is Casey and Barber, and I am here today to share my health education and promotion philosophy as the culmination to class HSC 6037, Philosophies and Principles of Health Education. Let me start off by reading my health education and promotion philosophy. I view health education and promotion as planned communication and activities designed to enable voluntary choices and shed light on the social and community influences that affect individuals' health. Health education specialists must empower people to take an active role in achieving a fulfilling life and make the best decisions possible throughout their life cycle. Health education should guide others towards making informed decisions while adhering to the principles of individual autonomy and respect for cultural diversity. My health education and promotion philosophy statement was inspired by my readings about Paulo Freire's and Charles Carroll's philosophy. During the semester, when we were learning about the current health education and promotion philosophies, the freeing and functioning philosophy resonated with me the most, and I hope to expand more on that during this presentation. In my current work as an oncology dietitian, while a lot of my time is spent providing education to my patients, the goal of the education is less about forcing change and more about guiding them to make informed decisions on their own. I believe that this is our goal as future health education specialists, and this presentation will cover why that is so important. The points that I will be covering in this presentation include health education empowers people to apply what they know about health to their own lives. Health education and promotion assists individuals and communities in increasing control over the social determinants of health, thus advocating for their health. Health education specialists should encourage change in ways that do not violate the principles of autonomy and respect. Let's start by discussing how health education empowers people to apply what they know about health to their own lives. This means that people must become active participants in their education and, in turn, apply new knowledge to the context of their individual lives. A key point that Wallerstein and Bernstein elaborate on in their paper is that in the empowerment process, people are not trying to dominate or gain power over others, but to gain momentum to work together with others to create change. Paulo Freire asserts that knowledge does not come from experts inculcating their information, but from a participatory dialogue approach where everyone has the role of co-learners. This helps to facilitate critical thinking about actions that can be taken to overcome the social influences that affect people's lives. Freire describes a three-part process of listening, dialogue, and action that allows empowered education to thrive. I think a great example of this learning dialogue action concept in action is the Alcohol Substance Abuse Prevention Program, also known as ASAP. The ASAP program was started in 1982 through the University of New Mexico School of Medicine. It brings middle and high school student volunteers from minority high-risk communities to the University Hospital Emergency Center and the Albuquerque County Detention Center. With medical and nursing students and faculty as preceptors, the students interview patients and jail residents with alcohol and drug-related problems. The students also participate in curriculum focused on adolescent health programs like life skills and alternative choices decision-making. After the students complete 4 interview sessions, they get additional training to become peer educators in both school and community settings. Listening skills are promoted, brainstorming sessions allow students to develop questions to ask the patients and jail residents, and then lastly, students are given a sense of responsibility as they lead small discussion groups in schools and community settings about what actions can be taken to prevent alcohol and drug-related community problems. While I do not have time to provide a more comprehensive overview of this program, I encourage you to read more about it in Wallerstein and Bernstein's paper that is cited at the end of this presentation. Now, my second point of discussion is that health education and promotion assists individuals and communities in increasing control over the social determinants of health, thus advocating for their health. This means that addressing social determinants of health can positively impact the health of people and communities on a larger scale. Cottrell et al. Noted that 30% of early deaths can be attributed to social circumstances, the social determinants of health, namely economic stability, education access, healthcare access, built environment, and community context. It is becoming increasingly important for health education specialists to work in a larger capacity to influence policy change to make it easier to achieve and reinforce health behavior choices. The goal of macro-level health education and promotion is to help enable people and their communities to have more control over the social determinants of health, with the goal being to improve their health. The importance of social determinants of health is outlined in Healthy People 2030. Healthy People 2030 is more focused on social determinants of health than in previous years, and it highlights more objectives unrelated to healthcare delivery to improve people's environments and consequently their health. This showcases the importance of addressing health problems at all levels, individual behavioral risks and socioeconomic risks to truly achieve sustainable, lasting change. Tying this point into my first point about empowerment, it is imperative that health education specialists focus on encouraging individuals to participate more in their communities and learn critical thinking skills. This will enable them to bolster their abilities to influence their personal and social environments. My last point of discussion is that health education specialists must encourage change in ways that do not violate the principles of autonomy and respect. For instance, we as health education specialists must acknowledge that our involvement with patients, clients, and communities may either not elicit immediate change or may not elicit change at all. At the point in time that we are working with an individual or community, we must realize that there may be more pressing or important issues going on in their lives that they are focusing on. As I mentioned earlier, health education is not about asserting power over others, and the role of the health education specialist is not to tell a person what is or is not important to them. Health means different things to different people. Health education specialists should understand that one's definition of health changes throughout their life cycle, and we should focus on assisting others to make the best choices for them to achieve their definition of good health or a good life, essentially meeting them where they are. Cottrell et al. Noted quite nicely that it is seemingly understood that health is a difficult thing to define, but something that most people intuitively understand. Article 1 of the Code of Ethics for the Health Education Profession even states that health education specialists display personal behaviors that represent the ethical conduct principles of honesty, autonomy, beneficence, respect, and justice. Health education specialists respect and support the rights of individuals and communities to make informed decisions about their health. At the crux of it all, we must understand that health education is trying to induce voluntary changes in behavior, and we must be careful not to blame individuals for engaging in health behaviors that are either out of their control or not in their best interest. I will end this section with a quote that I hold in my heart each day when I work with patients. Mendelssohn, as cited in Buchanan, 2006, page 299, states, "Education seeks to expand the intellectual horizons to facilitate rational choice from among alternatives. It does not seek to change behavior." So in closing, let me once again restate my philosophy statement. I view health education and promotion as planned communication and activities designed to enable voluntary choices and shed light on the social and community influences that affect individuals' lives. Health education specialists must empower people to take an active role in achieving a fulfilling life and make the best decisions possible throughout their life cycle. Health education should guide others towards making informed decisions while adhering to the principles of individual autonomy and respect for cultural diversity. Health education and promotion must foster empowerment and advocate for policy change that positively impacts social determinants of health, thus allowing individuals more control in making behavior choices, all while acknowledging and having respect for individual autonomy. Thank you so much for listening to my health education and promotion philosophy presentation today.